Assalamu alaikum everyone. I am your facilitator with the new topic of cell wall inhibitors, which includes only penicillin and cephalosporin. So let's begin the lecture. First antibiotic discovered by the Alexander Fleming, obtained from the Penicillium neonatum, presently Penicillin chrysogenum, that is bactericidal and effective against the gram-positive bacteria and less active against the gram-negative, and having the thiazolidine ring with the beta-lactam ring and the side chain by the amide ring. From the changes in the side link, it make the substitute or it make the new drugs of the penicillin. Penicillin. Mechanism of action: penicillin binding protein, bacterial enzyme which work as the maintenance of the morphological features of the bacterium. MRSA and penicillin binding protein. What does it mean? That means MRSA is produced by the any mutation in the penicillin binding protein. Next, inhibition of the transpeptidase and the production of the autolysin enzyme. Autolysin help in the remodeling of the bacterial wall. So in the absence of the autolysins, remodeling of the bacteria does not occur. So there is a disturbance in the integrity of the cell or the bacterial cell. Antibacterial spectrum: there are natural penicillin, that is penicillin G, procaine, penicillin V, and benzathine. The natural penicillin was the first antibiotic introduced in the clinical practice. Natural antibiotics are active against the gram-positive bacteria such as Staphylococcus, Bacillus species, and in the lesser degree against Enterococcus species. The most of the anaerobic bacteria are highly sensitive to the natural penicillin, that are penicillin G, penicillin V, benzathine. Natural penicillin are highly effective against the Treponema pallidum, Leptospira. Penicillins resistant penicillin, that are cloxacillin, decoxacillin, methicillin, neficillin, and oxacillin. Methicillin was the first member of this group, which is followed by the oxacillin, neficillin, and cloxacillin. Currently, oxacillin is the most widespread among the penicillinase resistant penicillin, and it's actively used for the treatment of the infection caused by the Staphylococcus, including MRSA. Aminopenicillin. Aminopenicillin include ampicillin, amoxicillin, and bicampicillin. Aminopenicillin are also known as extended spectrum penicillin. Aminopenicillin was the first penicillin discovered to be active against the gram-negative bacteria like the E. coli and H. influenza. Aminopenicillin are acid resistant, and what does it mean? It means they are administered orally because they do not destroy by the acidity. Aminopenicillin possess a broader spectrum of the antibacterial activity against some of the strains like the E. coli, Shigella, Salmonella, which are characterized by the low level of production of the chromosomal beta-lactamase. Aminopenicillin are susceptible to the hydrolysis by the beta-lactamase, and that's why it is used and come in combination with the beta-lactamase inhibitor, that are the clavinic acid and sulbactam. Extended spectrum penicillin, it is sometimes called as the anti-pseudomonal penicillin because it is highly active against the pseudomembranous colitis. Extended spectrum penicillin include the both alpha carboxypenicillin, carbicillin, ticarcillin, and acyl aminopenicillin, that is piperacillin, mezocillin. These are not included in the book or in the Lippincott. These antibiotics possess similar spectrum of the antibacterial activity as aminopenicillin, but with the additional bactericidal activity against the majority of the gram-negative microorganisms such as Pseudomonas aeruginosa. Pseudomembranous aeruginosa cause the infection of the eye or the ophthalmic infection. Along with the aminopenicillin, extended spectrum penicillin are inactivated by the beta lactamase, and these drugs can be used in monotherapy for the infectious disease or in the combination with the aminoglycosides. These are the example or the mnemonics of the penicillin. Acid resistant penicillin, or you can remember it from the vodka, that is V, penicillin V, oxycillin, decoxycillin, K, cloxycillin, because it has the sound of the C, or K, amoxicillin, ampicillin. Penicillin is resistant penicillin, remember of the condom, C, cloxycillin, O, oxycillin, N, neficillin, D, decoxycillin, O, oxycillin, and M, methicillin. Penicillin side effect, remember of the ABCD triple S, that is abdominal pain, anaphylaxis, black tongue, diarrhea, skin rash, stomach upset, and seizures. Regardless of its resistance, it is still the drug of the choice in gas gangrene and syphilis, which is caused by the C. perfringens and Treponema pallidum respectively. Uses and side effects. Penicillin is used in gonorrhea, UTI, peritonitis, pneumonia, and other respiratory infections, septicemia, and meningitis. But now, the drug of the choice in the meningitis in the clinical practice is ceftriaxone, which is third generation cephalosporin. Penicillin works as a bacteriostatic or the bactericidal. It can have these adverse reactions. And what are they? GI distress or oral and vaginal candidiasis, generalized rashes, anaphylaxis. And I feel itchy already will show the anaphylaxis reaction. Let's summarize the ADR of the penicillin, which is summarized as H2N2D, that are hypersensitivity reaction, which are ranges from the rashes, common rashes, to the edema. Next, diarrhea, nephritis, neurotoxicity, hematological toxicity.